Good afternoon, everyone, and thank you for joining me for my weekly update. Today I am joined by Dr. Lawrence Loh, our Chief Medical Officer of Health for the region of Peel, our Fire Chief Tim Beckett, who is also responsible for our Emergency Response Operations Centre, and Peter Dundas, the Chief of Peel Regional Paramedics. It's hard to believe that we are now into the 8th week of the pandemic. It has fundamentally changed how we live and reminded us of what matters most: our health, our families, our friends, and our way of life. The good news is that over the past few weeks, we've started to see the daily cases stabilize in Mississauga. So we are making progress. And that progress is being reflected in the slow reopening of the economy. Just a little over an hour ago, the Premier announced that garden centres, nurseries, hardware and safety supply stores can reopen this weekend with strict measures in place similar to what we are seeing in grocery stores. On Monday, retail stores with street entrances will be allowed to offer curbside pickup and delivery. I'm supportive of these measures, but they must be met with strict monitoring to see if they impact case rates. We must take this slow and steady and have a solid plan in place before we considering opening the economy any further. We cannot get too ahead of ourselves too quickly, or we run the risk of doing this all over again, and none of us wants that. The good news is that the virus is no longer setting the timelines. The virus isn't controlling us. We are controlling the virus. So let's do it right. Let's get it right the first time, and let's just do this once. I know the weather is starting to get nicer. People are getting antsy staying inside. We know that it's not fair to ask you to stay inside all the time. What we do need to do is we need to stay local and stay apart, and please use your common sense. This past Sunday, when the weather was warm, it was a beautiful sunny day, and those warm temperatures brought about some really concerning behavior, particularly in downtown Port Credit along the Lakeshore Strip. I saw it with my own two eyes. Sidewalks and parking lots were packed, making physical distancing impossible. Traffic had come to a standstill because of the sheer volume of cars, motorcycles, and cyclists on the street. I heard reports that one of the ice cream shops had to make the tough decision to close their doors because people were simply not respecting safe physical distancing measures that they had put into place. We cannot and will not allow crowding like this to continue. Our officers will be paying special attention to hotspots like Port Credit and other areas in the city. So please, make the responsible choice. If you see a crowd, turn around and go home. When we say stay local and stay apart, it is for your own good. We will be enforcing the rules. To that end, we have issued 116 COVID-related tickets. That's 17 since our update last week and 9 since the weekend alone. We have re-educated 24,000 people on the rules and turned away 24,000 cars from our parks. Yesterday, officers were called to a parking lot outside a coffee shop where roughly 100 cars, yes, 100, were gathered to socialize. Several people were outside of their cars sipping coffees and chit-chatting. Folks, parking lots are not the new social cafes. Those found gathering were ticketed, and our officers spoke to the managers to ensure that this does not happen again. Our business community has the responsibility to ensure safe physical distancing on their property, and that includes on their parking lots. Over the weekend, we also saw a brazen group of young people breaking into Korea Park overnight. I would like to remind residents that Korea Park is closed and will remain closed for the remainder of cherry blossom season. Instagram and TikTok videos, unfortunately, will have to wait until next year. The trees have just started to blossom, and you can view them in all their glory from the comfort of your own home at mississauga.ca/cherryblossom-webcam. To all the thrill seekers out there, you will face significant fines for illegally trespassing. As you know, Council and City staff continue to work to keep our city moving and have started planning for what the recovery will look like here in Mississauga. Today, Council hosted its 7th virtual meeting, and we took some further actions. Firstly, we voted to provide additional financial support to residents by way of postponing final tax installments. Almost all of our residents and many of our businesses have taken advantage of the 90-day property tax deferral. Today's announcement lessens the burden as the final installments are billed so that taxpayers don't have to catch up as quickly later in the year. We're still legally required to collect all property taxes by the end of the year, and we are on track to do just that. This decision provides further relief to residents and businesses to help them manage their cash flow and payments. Today, we also made the decision to waive penalties and all other fees on property taxes. This will allow greater flexibility for residents and businesses during this unprecedented time, should they need it. And finally, we're providing additional relief for low-income seniors and people with disabilities by way of increasing their tax rebate to $436 this year. Secondly, we put more services online, including culture, library, and recreation. We are a digital city, and we're offering many free virtual activities, including live fitness classes, nutrition workshops, wellness through arts, e-books, family activities, and so much more. Staying active, staying connected, and maintaining good mental health is so incredibly important right now. This is just one of the many ways we're trying to help residents stay engaged and entertained while they're spending more time at home. For more information, please visit mississauga.ca. And thirdly, we made the decision to ban the sale and the use of fireworks in Mississauga until the province has declared the emergency over with. There are several reasons for this decision. First, we want to prevent large crowds from gathering. We generally see communities and neighbourhoods coming together for firework displays over the Victoria Day weekend. We know they pose a fire risk, and we usually see an increase in both emergency calls and complaints to 311. Right now, we need to keep our firefighters and our enforcement staff focused on the task at hand, and that's fighting COVID-19, period and full stop. Similar to our firefighters, police and frontline nurses and doctors, our paramedics, have had to step up in a big way to help us handle the increased demand on our healthcare system. I now would like to invite our Peel Paramedics Chief, Peter Dundas, to provide us with an update on our paramedics' response to COVID-19. Chief Dundas?
Thanks, Mayor Crombie, and good afternoon. Since the start of this outbreak, Peel Regional Paramedic Services has been working around the clock to care for residents who have screened positive for COVID-19, to help contain community spread, and to ensure we continue to provide high-quality pre-hospital medical care to our communities. Recently, we launched a high-risk response team to address the increased safety and the risks that paramedics face today while ensuring our residents are properly served. This team allows us to continue providing life-saving procedures to the most critically ill, and to do so in a way that reduces exposure to our paramedic staff and other first responders. Peel Paramedics are also working in partnership with Peel Long-Term Care and Peel Public Health to stop the spread of the virus. Currently, we have more than 60 paramedics who are conducting testing and assessments in long-term care and retirement homes. Since April 12th, our paramedics have conducted close to 7,000 swabs. Peel Paramedics are also partnering with other regional staff to care for the homeless by doing daily testing and health checks on those who are most vulnerable in our communities. We have not seen an increase in call volume so far, and for this, I would like to thank residents for following the advice of Peel Public Health. Please continue to stay home and to practice physical distancing when you go out for essential services. I want to stress, though, that medical emergencies count as essential. While paramedics appreciate not seeing you, because, and hopefully, it means you are healthy and well, If you are dealing with a serious medical issue, don't be afraid to call 911. If you are having symptoms of a heart attack or stroke, such as chest pain, difficulty breathing, or slurred speech, don't try to manage symptoms on your own. Call us. Paramedics wear extensive PPE such as face masks, eye protection, gowns, and gloves on every call, and they are well trained in preventing the spread of infectious disease. In addition, our logistics technicians thoroughly clean and decontaminate any ambulance that has transported a COVID-positive person to ensure the vehicle is safe for the next patient. You are well protected with us, and you will be well protected with the doctors and nurses in the emergency department. Peel paramedics are always here for you. Stay home, stay safe, and stay well, everyone.
Thank you, Chief. And now I'd like to turn it over to our Chief Medical Officer of Health, Dr. Lawrence Loh, to provide us with a brief update on Peel Region's response to the virus. Thank you, Dr. Loh.
Thank you, Mayor Crombie, and good afternoon to everyone. As of noon today, we have 2,782 cases of COVID-19 in the region of Peel and 151 deaths. This includes 1,469 in Mississauga, 106 who have tragically passed away, including 60 in 60 long-term care home residents. Our hearts certainly go out to the loved ones and the families or those who are still battling this disease. And I do recognize that Mississauga has seen more mortality than some of the other municipalities in the region. This picture has largely been driven by various outbreaks in the city's long-term care facilities. And together with our hospital and healthcare partners, this has given us more motivation to control outbreaks and arrest spread. I am pleased to share that with our hospital and healthcare partners, Peel paramedics, and various other long-term care home administrators, we have completed provincially mandated testing of staff and residents at 27 of 28 long-term care facilities in our region. Many homes have also seen visits from rapid response teams that aim to arrest and slow the transmission of these disease and enforce isolation and infection prevention and control protocols. As Mayor Crombie pointed out, with the slowing of new cases in the community and the stabilizing picture in long-term care homes throughout our community, we are starting to see the curve flatten in Mississauga. I know that saving lives and protecting our frontline workers and responders has taken the whole of the community. Mississaugans have answered the call, and I want you to know that your sacrifices have been worth it. To be clear, though, flattening the curve does not mean that all is safe again. It simply means that our ship is no longer taking on water. We have patched the hole in our ship and are now able to better chart a course, but we are still very much in rough seas. If we act hastily, a flood may well overwhelm us again. Which brings me to my second point. Our advice has not changed. 8 weeks ago, I asked you to stay home and only leave for essential reasons, meaning groceries, gas, prescriptions, seeking medical attention, and exercise. We've also recommended that you physically distance when out and about and wear a non-medical mask in instances where that is not possible, such as in narrow aisles in a grocery or a drugstore. Remember that seeking health care, as Chief Dundas has pointed out, it remains an essential reason to emerge. And also equally remember that exercise is essential. Especially as the weather gets nicer, I encourage you to go out, either on your own, with your pet, or with people in your home. Make use of the new active transport corridors designated here in Mississauga. But remember, as you do, that distance is your friend. Move. Do not congregate. Do not join crowds. Stay 2 meters apart from people and respect the current closures that are in place. And ideally, stay close to home and pick less crowded hours to emerge. Please do not head out to hike on popular trails or day trip to attractions because a scenic hotspot may well become a viral hotspot if we're not careful. It only takes one person in a crowd that can't distance to set us back tremendously. So go out, stay close to home and stay home, and remember, let's go the distance. So with that, I'll pass it back to Mayor Crombie. Thank you.
Thank you, Dr. Lowe, and thank you, Chief Dundas. Before I conclude, I'd like to have an opportunity to comment on our financial position that we have found ourselves in as a result of COVID-19. As cities right across this country embark on a long road to recovery, I'd like to take a moment to make a direct appeal to both the federal and the provincial governments for assistance for cities. 2 weeks ago, the big city mayors in Canada made an appeal for emergency operating funding to help us cover our non-recoverable operating losses to keep us financially healthy so that we too can continue to provide the services that Canadians have come to rely upon. We have not yet received an answer. Property tax revenues aren't coming in, and we're losing transit revenues each and every day. Cities are the engine of the economy, and we will be critical to our nation's economic rebuilding. There is no one level of government closer to the people than us. We operate the essential services that keep Canadians safe and healthy: transit, fire, police, paramedics, housing, shelter, and so much more. We are stretched thin, and we have taken a significant financial hit from this pandemic. While the federal and the provincial governments can borrow against the future to pay for their expenses, cities cannot. We operate like a business, and in Mississauga, we are in an operating deficit of over $40 million right now. It could be over $60 million by June and could be $90 to $100 million within 6 months. Yet, we continue to work around the clock to keep our community safe and to deliver the essential services that keep us running. Our commitment is to serve our residents, and it never stops. We are on a 24/7 operation. Please, do not leave us behind. Now is not the time for jurisdictional politics. It's the time for action. This country cannot allow cities or allow our people to fail. Every other sector has been provided relief except for us. Cities cannot legally run deficits, nor should we be. We do not have the mechanisms to make up for the losses, even over time. We will continue to do our part. We have provided relief for residents and for businesses during this crisis where we can, in the form of tax deferrals, free transit, and other license and fees. We have made the difficult decision to temporarily lay off 2,000 part-time staff, mostly in our recreation facilities and libraries. We are the only level of government that has had to lay off people. And we will continue to make those tough decisions in the months ahead. But in the face of no assistance from the provincial or the federal governments, Mississauga could face a 17% tax increase in 2021. No property owner can or should have to absorb such a drastic increase, and most certainly not during these challenging times. We will have to make some serious cuts to service and raid reserves to offset such an increase, or to hold off infrastructure projects that keep our city in a state of good repair. Without federal or provincial assistance, these challenging times will continue, and we'll find ourselves in serious financial trouble in the years to come. We're not asking for a bailout. This is an investment in our people and in our future, and is an investment in keeping our economy and our country running. If you want economic recovery to go smoothly, you need cities to be operating at peak performance. I want to close once again by asking residents to keep up the good work. It is Mother's Day this weekend, which I know is a special time for all the people in our city. While we usually take our mothers out to brunch, I know I do, or have them over for dinner, this year I encourage you to do it differently. Find a different way to celebrate. Apart. Do it virtually through Zoom or FaceTime or WebEx or House Party, whatever you might use. I want to give a special shout out to my 84-year-old mother, Veronica. Veronica is in self-isolation and has been for the better part of 2 months, well, 2 years if you count her hip replacement. And all I know is that she will miss our annual brunch tradition, and that's been keeping her healthy and safe, and that's really the most important thing right now. I won't give away what my plans are for her, but I will let you know that she's asked for my special peach cobbler, so Mom, maybe that's coming. Well, I'll do my part. I have a funny feeling she might be tuned in right now. Not to put the dads out there at an unfair disadvantage, there's still lots you can purchase for your wives and mothers and grandmothers, etc. online. But if you keep up the good work, dads, hopefully by Father's Day, we can proceed with Father's Day as we know it, although with enhanced health and safety measures as described through physical distancing. Thank you, and I'd now take questions from the media.
Mayor Crombie, your first question comes from Tina Yazdiani from City TV. Tina, please go ahead.
Hi, Mayor. Thanks for taking my question. I was wondering if you could provide more details on the 100 vehicles that were gathered in the plaza. Were people staying in their vehicles, and how many people were actually were charged in that situation?
Do we know? You know what, Tina, we're going to have to get back to you. So these are the updates we receive every day from our bylaw enforcement. Certainly we know that there were over 100 vehicles in a plaza, gathered together, drinking coffee, probably ice cream, having ice cream as well, and, quote, socializing and not practicing safe physical distancing. And as a result, a number were fined. But we'll get that information to you, Tina.
Okay, thanks. I also wanted to ask about if you could comment on the decision in council today regarding the call for prayer. Just your comments on what you thought about people trying to reverse that decision.
Well, at the end of the day, I think our council wanted to have a more fulsome conversation about the issue, but I'm very, very pleased that we reconfirmed our commitment and the decision we made last week to allow the call to prayer during Ramadan. As you know, we're one of the first cities to step up and do so in the GTA. It is a temporary exemption to the noise bylaw, and we did so at our discretion because we felt that anything that provided hope and inspiration during this time of pandemic was a good thing. It was a very reasonable request for a limited period of time, and we just reconfirmed our commitment today after having some fulsome discussion. We also referred the issue and these kinds of matters to our Diversity and Inclusion Advisory Committee to discuss how accommodations like these could be handled differently in the future. I mean, given it is a pandemic and that committee isn't meeting, Council took these issues into our own hands, and we did make the right decision, and I think at the end of the day, they just wanted to have a more fulsome conversation about the outcome. And, you know, preferably we'd like the entire community to weigh in on these kinds of matters in the future. But I am very delighted to have seen many of the support letters that we did receive. And in particular, we received a very strongly worded support letter from the Peel Multi-Faith Council this morning. And that was very helpful indeed.
Mayor Crombie, your next question comes from Ashley Newport from InSaga. Ashley, please go ahead.
Hi, Mayor Crombie. So obviously now the province is moving very slowly towards reopening some businesses and some stores bit by bit. But I know that some public health experts have talked about how very large events like festivals, concerts, plays, sporting events might not be safe for, potentially a year or more. What potential financial impact could this have on Mississauga since you have, events at Celebration Square, since you have the Paramount Fine Food Center, since you have the Living Arts Center? Has any work been done to kind of crunch the numbers on how much the city could lose if you can't host any large events for the next, 18 to 24 months, worst case scenario?
That's right. So I think those are all factored into the financials that I gave you earlier, the $43 million deficit position we see ourselves in today, the $60 million by the end of June, and the $90 to $100 million by the end of the year. Certainly most of the festivals that had been planning to operate within our Celebration Square have been cancelled. It's just too much pre-work would have to go into, would have to be put into place, and as well as financial deposits would have to be made, and it just wasn't wise given the uncertainty of whether or not more than 5 people would be given the permission to gather at any one time throughout the summer. We just don't know. We don't know when the ban of 5 unrelated adults gathering together will be lifted.
Thank you. And my second question is actually for Dr. Lowe.
Certainly. I'll allow him to come to the podium.
Hi, Ashley. Go ahead with your question.
Hi, Dr. Lowe. So yesterday during a press conference, Premier Ford said that, and he didn't say who in particular, but he said that some public health agencies are doing less testing than others, and that he was frustrated with regions that weren't testing as much as others. I just wanted to know how you felt about his comments, and also if you could say how many tests Peel Public Health is performing in a day, and how many more you have capacity to perform.
So Ashley, it's a great question. In terms of, I'll answer the last part first, which is really in terms of the testing, that's all tracked actually at the provincial level. And certainly many health units have been, in process of starting to request health unit specific data. But if you go to the Ministry of Health's website, you can actually see the number of tests that are being done across the province. In fact, what we actually are most focused on at Peel Public Health is not the tests done, but specifically when you're thinking of controlling outbreaks, you're trying to think about controlling them within facilities or within venues. And so I'm pleased to report that thanks to the work of many hands, where our healthcare partners, Ontario Health Central Region, our hospital partners, our paramedics, we've managed to swab 27 out of 28 long-term care homes in the region of Peel, and we've done that well in advance of the May 15th deadline that the Premier has set. And to your first part of the question, I very much appreciate Premier Ford's passion for the work that is going on. I know that we are all on the same side here. None of us want to see mortality or morbidity in our long-term care and retirement homes and our seniors setting, and we certainly want to see a stabilization in that before we're able to proceed with opening the province. So certainly we, at least at Peel Public Health, look forward to at least continuing to focus on swabbing our homes and working with the province in making sure that we protect this, our seniors and our elderly populations.
Thank you, Dr. Lowe. Mayor Crombie, your next question comes from Steve Cornwell from the Mississauga News. Steve, please go ahead.
Hi, Steve.
Mayor Crombie.
Welcome.
Just wanted to ask about the calls to prayer and some of the kind of response to it. Many councillors kind of discussed the getting kind of a flood of messages, and certainly it's been an issue with some hateful messages on social media. Has this reaction surprised you at all in terms of allowing these calls and how people in the community have responded?
I think any time we deal with issues that involve faith communities, you see this kind of flare-up of reaction, sometimes visceral reaction. We certainly saw both the negative and the positive when we had to deal with the new mosque being proposed in Meadowvale. But, I'm heartened because we saw many messages of hope and inspiration. I saw many people standing up and speaking for what they thought was right. They all felt that this was done with good intentions to provide hope and inspiration and support in a very dark time of this pandemic. And you know that if any other group stepped forward and made a special request, we would, if it was a reasonable request with a limited timeline as this one was, then we would honor it as well. This is a time that whatever we can do to provide joy, we should go out of our way and do. So yes, we saw both pro and con and a mix of both, and it was a trying time, but we're through that hump now, and I think we're going to move forward with the issues at hand to deal with the COVID-19 pandemic.
Thanks. And my second question is actually for Dr. Lowe.
Sure.
Hi there. Go ahead with your question.
Dr. Lowe, I just wanted to clarify, I was listening into the town hall last night, and I believe you said that all 28 long-term care facilities in the region have been tested, but today, I believe you said it was 27 out of 28. Did you misspeak last night, or is that is something changed? Or
Absolutely. I'm happy to answer that. So as you know, we have been working with various long-term care homes throughout the region. Sometimes we go in to test them, sometimes they go in to test them. As it turns out, there was one home which we were still in the process of figuring out how it was going to get done, but that home is now scheduled to be completed either today or tomorrow, and certainly by the end of the week, and still well in advance of the May 15th deadline that has been set by the province. Thank you.
Mayor Crombie, your next question comes from Nita Safar from The Pointer. Nita, please go ahead.
Hi, Mayor Crombie. Just during, a follow-up on the earlier decision today about the call to prayer. During the pandemic, if other religious groups also come forward with a similar claim to broadcast something, what procedure would they have to follow?
So certainly I think the best route is to email myself or the councillors and say, you know, we have a particular message we'd like to send or a particular action we'd like to take, and we'll evaluate it. Our council continues to meet each week virtually on Wednesdays during the council period, and we open it up to all faiths.
Thank you. My next question is for Dr. Lowe.
Hi there, thank you.
Hi, Doctor. This question it's a follow-up from one of the earlier questions, and I didn't hear an answer for it. So yesterday, Premier Ford said some of the regions were falling behind on testing and needed to, quote, pull their socks up. Is Peel Region one of those regions?
I think the Premier, as I mentioned, he certainly has a lot of passion for the work. It wasn't clear to us, at least at the time, as to which regions he was referring to. I can only speak to what we're doing in Peel, which, as I've mentioned, is that we have managed to get 27 of 28 long-term care homes tested. Certainly have also started to move into other congregate settings, group homes, etc., retirement homes, and with an aim to get the last long-term care home tested by the end of the week, and certainly ahead of May 15th and the deadline. So I would refer you back to the province if you need further clarity as to the Premier's specific comments. Thank you.
Thank you, Dr. Lowe. Mayor Crombie, your next question comes from Khalid Salema from the Iranian Times. Khalid, please go ahead.
Hi, Mayor.
Hello, how are you? Khalid?
Can you hear?
No, you're cutting out, Khalid. Hello?
Okay.
Do you want to maybe email in your question to Nicole?
Khalid, I think you keep muting yourself. Let me try that one more time. Please go ahead.
Can you hear me now?
I can hear you now, yes.
Very well. Sorry. Mayor, I have a message for you on behalf of many of Mississauga residents complaining about noise pollution caused by modified mufflers and vehicles and motorbikes. That's day and night. Mm-hmm. And residents cannot report the moving vehicles in the absence of enforcement. How can you help them with that, Mayor?
Yes, so certainly they should be phoning 311. Our bylaw enforcement officers are active. We are revising our noise bylaw, and that should be brought back sometime at the end of May, and it will discuss many of those items that you referred to.
I see. And my second question to Dr. Lowe, please.
Yes, certainly.
Thank you.
All right, go ahead, Khalid.
Dr. Lowe, how are you?
I'm doing very well, thanks.
I have a question regarding COVID-2s. Did you discover any cases, especially in kids? And do you have special information about that? And if you have, do you have any numbers? Thank you.
Thank you so much, Khalid. Certainly the phenomenon of COVID toes is something that is actively being studied. I know that it has been reported through clinics both in Canada as well as many other jurisdictions. At this time, we haven't been tracking that specific symptom just yet, and we have been very fortunate that children in our region have certainly been least impacted. They're the least impacted age group in number of cases. But it certainly is an interesting finding, and as the evidence base around COVID-19 continues to evolve, COVID toes as well as other clinical symptoms will continue to assist our ability to identify and diagnose this disease, send people for testing, and subsequently to isolate them and protect the public. So thank you very much for the question.
Thank you, Dr. Lowe. Mayor Crombie, that's all the questions for today. This concludes today's press conference. On behalf of the Mayor, I want to thank everyone for participating. Our media team will be sharing a link to the video of the press conference with you shortly. Have a great day, and thanks for joining.